Bismillahirrahmanirrahim. Assalamu alaikum. I am your teacher and tutor, Sir Mehmood Ahmad. As you know, we were studying biology class 10, and today is our lecture from class 10 biology is chapter number 1, and the topic respiratory disorders. So let's move to our topic. First of all, the very first question: what are respiratory disorders? The disorders are diseases that occur in respiratory tract or affect the respiratory tract are called respiratory disorders. For example, bronchitis, asthma, pneumonia, and lungs cancer. So the very first disease or disorder of respiratory tract in our book of class 10th biology is bronchitis. So what is bronchitis? The inflammation of the bronchi or bronchioles. As we know that what are bronchi or bronchioles? Bronchi are the two tubes that exist from trachea. And what are bronchioles? Bronchioles are the very tiny tubes that exist from the bronchi. So basically, what is bronchitis? It is a disease that in which the inflammation of bronchi or bronchioles. So bronchitis is the inflammation of the bronchi or bronchioles. It results in excessive secretions of mucus into the tubes and leading to the swelling of tubular walls and narrowing of tubes. So in this disease, the very first symptom is the inflammation of the bronchi and bronchioles. The second thing is it results in excessive secretion of mucus into the tubes, and that is leading to the swelling of tubular walls and narrowing of tubes. So what are its causes? How is it caused, or for what is it caused by? This disease is caused by the viruses, bacteria, exposure of chemical irritants such as tobacco, smoking or smoke, etc. So students, these are the two diagrams of our bronchi. This diagram of bronchi is the diagram of normal bronchi, and on the other hand, this is the diagram of inflamed bronchi that shows how a bronchitis affects a bronchi. I hope you have understood this. Now let's move to its types and symptoms. Dear students, types of bronchitis include two types: acute bronchitis and chronic bronchitis. So there are two types of bronchitis. Number one, acute bronchitis, and number two, chronic bronchitis. What is acute bronchitis? Acute bronchitis usually lasts about 2 weeks, and the patients recover with no permanent harm to the bronchi or bronchioles. The second is chronic bronchitis. What is chronic bronchitis? In this, the bronchi develop chronic inflammation, usually lasts for 3 months to 2 years. I hope you have understood this. Let's move towards its symptoms. Students, symptoms of bronchitis include a cough, mild wheezing, fever, chills, and shortness of breath. Remember one thing, in this disease, the shortness of breath only occurs when doing some hard work, except it mostly do not occur. So I hope you have understood completely this topic of bronchitis, one of the respiratory disorders. Okay, students, the second respiratory disorder is emphysema. What is emphysema? It is the destruction of the walls of the alveoli. It results in larger sac but with less surface area for gaseous exchange. As lungs tissue break down, the lungs do not come back to their original shape after exhalation. So air cannot be pushed out and is trapped in the lungs. This is basically the disorder of the functional and structural unit of lungs, that is alveoli. So what happens in this disorder? Alveoli, the wall of alveoli breaks down and the surface area decreases and the surface area decreases and the size of that tissue or the sac increases, but surface area decreases. What are its symptoms? The symptoms of emphysema are include shortness of breath, fatigue, recurrent respiratory infections, and weight loss. By the time the symptoms of emphysema appear, the patient has usually lost 50 to 70% of his or her lung tissues. The level of oxygen in blood may get as low that it causes serious complications. I hope you have understood this topic. These are the two diagrams of alveoli. This is the normal alveoli where the air comes and it swells the walls of alveoli and then again pushed out. But in emphysema, the walls of tissues of alveoli breaks up and it becomes larger, but the surface area hole becomes lower and the air comes in and pushes the wall, but it cannot be pushed out of the walls. I hope you have understood. If you have any question, you can ask in comments below. Now let's move towards the third disorder. Students, our third respiratory disorder is pneumonia. What is pneumonia? Pneumonia is an infection of lungs. If this infection affects both lungs, then it is called double pneumonia. The most common cause of pneumonia is a bacterium called Streptococcus pneumoniae. Some viral influenza virus and fungi infections may also lead to pneumonia. When the causative organisms enter the alveoli, they settle there and grow in number. They break the lung tissues and the area becomes filled with fluid and pus. The symptoms of pneumonia include a cold that is followed by a high fever, shivering, and a cough with sputum production. Patient may become short of breath. The patient's skin color may change and become dusky or purplish. It is due to poor oxygenation of blood. Vaccines are available to prevent pneumonia caused by Streptococcus pneumoniae. Antibiotics are used in the treatment of this type of pneumonia. Students, this is the diagram or picture of a pneumonia patient. The alveoli filled with pus or mucus. This is the normal alveoli and this one is the pus-filled alveoli. This is a disease in which patient suffers a lot. Students, the fourth respiratory disorder is asthma. Asthma is the form of allergy in which there is inflammation of the bronchi, more mucus production and narrowing of the airways. In asthma patients, the bronchi and bronchioles become sensitive to different allergens. Allergy causing factors are known as allergens. For example, dust, smoke, perfumes, pollens, etc. When exposed to any of such allergens, the sensitive airways show immediate and excessive response of constriction. In this condition, the patient feels difficulty in breathing. The symptoms of asthma vary from person to person. The major symptoms include shortness of breath, especially when exertion or at night, wheezing, whistling sound when breathing out, cough and chest tightness. The chemicals with ability to dilate the bronchi and bronchioles are used in the treatment of asthma. Such medicines are given in the form of inhalers. Students, this is the diagram of asthma patient. You can easily see that the difference of normal bronchus and constricted bronchus. Students, the fifth disease or disorder is lung cancer. Lung cancer is a disease of uncontrolled cell divisions in the tissues of the lung. The cells continue to divide without any control and form tumors. The cellular growth may also invade adjacent tissues beyond the lungs. The most common symptoms are shortness of breath, coughing, including coughing up blood, and weight loss. The main causes of any cancer include carcinogens, such as those in cigarette smoke, ionizing radiation, and viral infection. Smoking is the main cause of lung cancer. This risk of lung cancer is significantly lower in non-smokers. Cigarette smoke contains over 50 non-carcinogens. Passive smoking, the inhalation of smoke from another's smoking, is known as passive smoking. So, passive smoking is also a mass cause of lung cancer. The smoke from the burning end of a cigarette is more dangerous than the smoke from the filter end. Eliminating tobacco smoking is a primary goal in the prevention of lung cancer. The World Health Organization has called the governments to stop tobacco advertising to prevent young people from taking up smoking. I hope students you have understood all five disorders, respiratory disorders that are in your textbooks. If you have any question, you can ask in the comments below, and do like, subscribe and share my channel. The next topic is bad effects of smoking, so let's move to that topic. Students, now our topic is bad effects of smoking. As we all know that how smoking is dangerous, how much it affects a human life as well as any organism's life. So we should be aware to its causes, its effects, and we should also aware others to avoid this. Smoking is harmful due to the chemicals in cigarettes and smoke. Tobacco smoke contains over 4,000 different chemicals, out of which at least 50 are carcinogens and many are poisonous. Many people think that lung cancer is the only smoking related disease and it is the number one cause of death among smokers. But it is not right. Cigarette smoke affects the body from head to toe. Smokers have a much higher risk of developing a number of life threatening diseases. Students, you can see the difference of a normal lungs and a smoker's lung, and you can understand that how smoking is dangerous for our health. So please do not try this and avoid this, and also aware others from its diseases and harms. Let's move to our topic. Smoking may also lead to the cancers in kidneys, oral cavity, larynx, breast, bladder, and pancreas. Many chemicals in tobacco smoke damage the air passageway, which leads to emphysema and other respiratory disorders. Smoking also has effects on the circulatory system. The carbon monoxide present in tobacco smoke lessens the oxygen carrying capacity of hemoglobin. Many other chemicals in smoke increase the production of blood platelets. When platelets are more than the normal number, they make the blood viscous and it can lead to arteriosclerosis. So, smokers are at greater risk of developing infections, particularly in the lungs. For example, smoking increases the risk of tuberculosis by 2 or 4 times and of pneumonia by 4 times. Smoking is also responsible for weakening and staining the teeth. Tooth loss is 2 to 3 times higher in smokers than in non-smokers. So students, I hope you have understood all these 2 topics, including respiratory disorders and the bad effects of smoking. So I hope you have understood. If you have any question or any question raised in your mind, do ask, do like, share and subscribe my channel Mehmood Ahmad MTC. Till the next video, next time, see you soon. Allah Hafiz, Pakistan Zindabad.